Welcome to Spinal Chat, the official podcast of the Pennsylvania Chiropractic Association. Today's episode features the June President's address from PCA President Dr. Chris Arnold. This address was originally shared in the PCA monthly newsletter and is now offered here as a special audio edition for PCA members and the broader chiropractic community. In this update, Dr. Arnold covers important insurance developments involving UPMC and Highmark, progress on sports chiropractic and PIAA engagement, new connections with chiropractic universities, the Pitt chiropractic program, and the continued importance of PCA membership. Now here is PCA President Dr. Chris Arnold with his June President's address.
Hello, fellow chiropractors. Dr. Chris Arnold here from the Pennsylvania Chiropractic Association, bringing you some breaking news that we want to make sure you're aware of that deals with UPMC and Highmark Insurance. Also talks about our sports chiropractic program and certain updates and connections with our universities, and specifically the Pitt program. So as always, it's a busy week at the association, lots of stuff happening, and we want to make sure you're aware of what's going on behind the scenes as our association is promoting chiropractic in our state and how we're protecting and defending the rights of every chiropractor so we can practice and deliver the amazing care that we do every single day. So let's just jump right into it. There was a notification came out from both UPMC and Highmark just this last couple of weeks. They kind of made the announcement that they were going to stop certain payments for certain general codes that they're not going to reimburse for anymore. The association did some digging and found out that the codes that Highmark are now going to reject has not associated with the chiropractic code. So it's not going to really affect us at all, which is good news. UPMC has not been forthcoming with their code set that they're actually denying. We're not sure if it's going to follow Highmark, where it was more just general for all providers, or if they're going to be specifically for chiropractic. So we always at an association encourage you to use proper billing techniques. Make sure you're using the most specific codes that you can. So we know last year they kind of got rid of the general lower back pain unspecified code for most providers. So if you're still using generalized codes like that or subluxation codes, those codes aren't really specific enough. So we always encourage you to be as specific in your coding to help make sure you're getting reimbursed for the great care that you're providing. We also want to know and understand through Highmark, there was some questions about the authorization system. There was a notification that came out that we chiropractors do not actually have to get authorization codes for 9894 codes. We recommended at the time to still get the authorizations because the authorization system Helion had not updated yet. And now we're actually informed that it is updated. So if you're just billing a 9894 code, those are just only for your Medicare Advantage plans that doesn't cover any other modalities. Those now do not need an authorization to start to perform those. So that's good news. But if you have a commercial plan where they have where they pay for codes of the 9894 codes, but also your 97 codes, or any other modalities you do above and beyond just the chiropractic adjustment, you still have to go through the full authorization system, just like you did before that notification. So we'll take it as a small win. I know the association has been pushing back hard against the Highmark to make sure that they are trying to minimize the administrative burden that they're putting on us to provide some of these services. So we're thankful for at least a little bit of relief on that. But again, if you're just a straight Advantage plan, Medicare replacement plan, then you don't need your authorizations through Helion. But if you are doing any other commercial plans or need other codes beyond chiropractic, you will still need that authorization like you have done before. I also want to make sure that you're aware of resources out there. If you aren't aware of, if you go to our homepage on our website, penchiro.org, there's actually a big insurance help button on there. That's a way for you to submit any insurance questions you have to our insurance help team. We have Karen Toner and a few other people that are on board that are reviewing all of these. They have over 40 years of experience of dealing with insurances and how to get the most. So use that resource. That's why your membership gets paid for to provide these great resources. So use that for any questions that's insurance related. And the other resource I want to also point out to you is we have an online, on-demand insurance education course. It's called the PCCI. It's a Coding Compliance Institute that actually put on a great seminar that actually will teach you from A to Z of how to get the right coding, the right insurances, how to get the right diagnosis, how to submit everything, making sure your insurance billing is up to snuff and it is clean so you get less rejections. It's an amazing course, and it's also available for CEs. So if you want to learn more about that, what all you have to do is click the link below. It will take you to our online and on-demand courses that includes that, also other ones. So make sure you take advantage of that. If you've not done the PCCI learning for insurances, if you're billing insurance, it is an absolute must. So take a look at that. The next thing I want to talk about is a little victory. It has to do with our sports chiropractic program and our working group with that. The biggest rub that we're getting now is the PIAA. Again, they're just blatantly being discriminatory towards chiropractors and how we integrate into the medical system. Right now, currently, the chiropractors are not allowed to sign off on student athletes to go return to play, even though we might have treated them for an injury. We can't sign off that they're healthy enough to go back to the field of play. We cannot do pre-sports physicals, and also we're not allowed to do any sideline care, even though we have professional chiropractors that have had extensive training in sports training and athletic training, and not allowed to be able to do that on a sideline, which is just basically discriminatory. So we finally have a Representative Brennan, who now has actually introduced something into the House floor, a memo that's trying to force the PIAA to actually have conversations with the PCA so we can figure out what we can do to get past this barrier. Because right now in rural areas, there are a great need for actually student athletes to have access to healthcare that are not being able to provided by athletic trainers or other organizations, and we want to be able to fill that gap. And also too, if athletes are coming to us already for treatment for their injuries, we should be able to return them to play. So it's great news that we have some legislative push trying to force the PIAA to actually have a conversation with us, and we're hoping that will actually turn into some action. Speaking of sports cars, I want to just make a quick shout out to Justin Miller, who just got back from Europe doing the Winter X Games or X Games over there. So it's amazing that we have one of our own that's over there in a special type of activities and stuff that's actually representing chiropractic in a very positive way. So congratulations, Justin, for being able to go over there and supply the athletes over there some great chiropractic care. Next thing I also want to bring you up to date on is some updates on our connections with universities, specifically chiropractic universities. We know that one of the biggest gaps that we have coming up in the very near future is the lack of students actually coming to the state. So right now, through our secretary, Dr. Niraj Patel, we actually are having connections to different universities. He sits on the board of Life West, has connections to a lot of other universities. So he's going to use those connections to, first of all, number one is promote association joining by students so they can actually get involved in associations very early in their career. The PCA actually has free associations for membership, so free of memberships for any type of students, and especially first-year doctors get free membership to the association. So we're making sure students and young doctors are aware of that. So if you know of anybody, young doctors out there that are needing a little bit of help, make sure they know that the association can be there for them. The other thing we're also trying to work on is trying to get connections where we can actually mentor students, where some of the doctors can speak to some of the students through Zoom links and stuff and be able to talk into them. So we're working with the Northeast Health Sciences, which used to be NYCC, and also the Pitt program to be able to connect to those students. So we can, again, pull them more towards the state because we need more good chiropractors in the state of Pennsylvania, as we have a lot of now doctors actually as retirement. Speaking of retirement, I just want to make a quick shout out to my buddy, Dr. Roy Love. After 40 years of practicing in State College, today is the day he's retiring. So congratulations, Roy, on helping thousands of actually patients better. Again, he was past president PCA, and I know you impacted tons of other offices and statewide. If it wouldn't be for you and your passion, he's still very active in the association. The association would not be anything compared to what it is from you. So congratulations on that. One last victory to finish out, back to our connection with the Pitt program. The first class is already started in the Pitt program, which we're happy and excited about that. They are a University of Pittsburgh chiropractic program. They are actually a member of the PCA. They're our first official school that's joined the association, which is awesome. So we're working that relationship. And we just finally got their association or their university to write a letter supporting some of the legislations that we're trying to promote, whether it be our delegation and our scope of practice. So this is a huge victory for us because we know Pitt actually gets lots of state funding. So if we have a university that's getting state funding that is now supporting chiropractic initiatives, it gives us a little bit more push and emphasis when it comes to talking on down at Harrisburg. So it was a huge victory. We're continuing to work that relationship as much as possible to make it both beneficial for the Pitt program and also for the PCA. So just want to give you those few updates. Again, if there's any other questions you have, feel free to reach out to the home office. Our staff of Linda and our executive director, Mike, will definitely love to help you out and answer any questions that you can. Again, just encourage you to continue your membership because, again, it's only a strong membership that keeps our association fighting hard. And if there's anybody that you know, friends and colleagues that's not part of the association, tell them it's time to get on board. Our association is way better and way bigger than it was even 10 years ago. We're making some huge strides and changes, but it only comes with extra help, with extra finances. So we just would really encourage you to support an association that's fighting for you every single day, that's delivering value back to you, helping you practice a little bit more simpler, a little bit more easier, so you can rest a little bit easier in the evening and be more productive and enjoy life more. So again, appreciate everything and look forward for the next update.
Thank you for listening to this President's Address from the Pennsylvania Chiropractic Association on Spinal Chat. Dr. Arnold's message is an important reminder that PCA is working every day to keep chiropractors informed, supported, and engaged. From insurance advocacy and sports chiropractic to student outreach, continuing education, and legislative progress, the strength of this work depends on an active and connected membership. If you are already a PCA member, thank you for standing with the profession. Please continue to follow PCA updates, use the member resources available to you, and share this information with colleagues. If you are not yet a member, now is the time to join. The future of chiropractic in Pennsylvania depends on doctors choosing to stay connected, informed, and involved. Until next time, stay informed, stay connected, and keep delivering the life-changing care chiropractic provides.